Now, I want to introduce our next speaker. She is what I call one of our babies, and we've got quite a lot of them, thank goodness. June McKee is here. We consider her one. I don't know, I hope no one's offended because we say you're one of our babies, but I need a better term. But these people had to rely upon the organization to a great extent to provide them with help. Now, Doris has done a marvelous job, and our role has not been to give guidance in the sense that we say, do this, do that, do the other thing, and you do it without understanding why. Our role has always been to try to educate that individual so that no matter what circumstances arise, they have a fairly good idea of what to accept and what to reject. They become knowledgeable individuals on their own. I see her sitting here. Now, we're going to handle this a little differently than we do most lectures, and people have their own personalities to deal with. I'm going to do an interview with Doris. I'm going to give her this mic, and I'll do the interview from that mic. And I think I can help Doris to elicit the most important part of the information without her being nervous, although she's been before our mic over and over again. You know, it's not the help we gave, it's the quality of the patient. This too, Dr. Jensen, I was in the audience this one time when Dr. Jensen spoke from a platform out in California, not here. And he told a little story about a patient who came into his office. And she sat down and she said, I've been to see so-and-so, I've been to see so-and-so and so-and-so, and it's as though, well, now I'm coming to see you to see what you can do. He said, she's looking for the good doctor. He says, I'm looking for the good patient. Here's one of the good patients. First, I want to say, when Doris called me, and she called me herself, and I like that. I like the cancer patient involved instead of having someone assume responsibility for the patient. I know there are husbands who feel concerned about their wives, wives concerned about husbands, parents about children, children about parents, but if the best way to handle a program is to make it the patient's program, to make it the patient's decision to do whatever has to be done. As someone I spoke to yesterday, and he used the typical analogy, and that was, you can take a horse to water, but you can't make him drink. What you want is a motivated patient, not necessarily the motivated supporter. Doris called. I heard a voice on the telephone, and my ears are very sensitive to voices, and I can practically say to someone, have your lungs filled up with water, because I can hear the breathing, or how tired they are you bedridden, things. We get sensitive in the work that we do. And I heard Doris's voice, and I said, oh my goodness, this is going to be a very difficult case if it's at all possible. She was bedridden. And we don't turn anyone down, so we began to work with Doris. Now, how long ago was that?
Well, around October 1971.
And when was your original diagnosis made?
About that time.
Would you tell the audience what had taken place from the time your diagnosis was made until the time you called us? In other words, the surgical procedures, what you...
Yeah. Well, I discovered a lump on my right breast. My husband and my chiropractor suggested to see a doctor.
Is that all right or not? Yes. No, I'm interfering with the taping. I can't do that. Go ahead. I can? Turn this up?
Yeah, you can use that one.
I'll hold it for you.
I made an appointment, and of course, the doctor examined me and said that the breasts appeared to be badly bruised. He called my husband in the office and, of course, explained to him what had to be done immediately. Then the surgeon said that the condition was dangerous and that he had to take a biopsy of the problem I was going through. And of course, if the lump was benign or malignant, that it had to be taken care of. But around November 1st, that's when I had my first operation. And that year and a half's time, I had 7 operations. So, of course, that next day, I had the surgery taken care of. And of course, I was unaware of what was happening when the surgery was being done. But later learned that the biopsy confirmed that the doctor's worst fears, and he had performed the radical mastectomy. The next morning, my doctor came in to see me, and he told me he was very sorry that he had to do this mastectomy. So when I asked him if it was, did he get it all, and he says, I am not God, but I did my best. He had entered the hospital that morning when I was walking down the hallway, and I was supposed to be going home that Sunday, and he mentioned to me that I would have to be operated on a hysterectomy. And that was very shocking to me because I didn't expect all this happening to me. So when I got up when I went back to my bed, I wept and wondered what else was going to happen to me. So several days later, I had the hysterectomy. 10 days later, the doctor removed stitches from my chest. And I can't really explain, there's no way of explaining how painful it was, because the doctor was even surprised that it looked so bad. So, of course, there was much pain and bleeding, and he bandaged me quickly and shook his head and said, "You need a lot of rest." And I looked at his face and I thought, oh boy, what else is going to happen to me besides this 2 operations? So finally, after 12 days in the hospital, I was able to go home, but very weak and a lot of pain during both operations. Once I was home, the condition got worse, of course, and the area of the mastectomy continued to drain and bleed, and the odor from it was unreal. I just couldn't even accept that. It was very hard on me. Though I visit the doctor once a week, there was nothing he could do couldn't stop the unpleasant situation. After several months, about June 14th, 1972, I was readmitted to the hospital for a skin graft to cover the area of my chest. The skin was taken from my right upper thigh to the area of my chest. The pain was so intense, it felt like a knife was cutting into me. I was giving medication to relieve the soreness in both thigh and chest. After 15 days, I went home, but paid frequent visits to the doctors in his office. So in July, then it had to be repeated. July 26th of 1972, I went back into the hospital for the similar grafting, and that was the second one I was having. During the difficult period, my husband devoted care helped me to keep going through it all. He would use syringe to irrigate the graft area and try to cheer me up. But despite constant efforts to keep the area clean, it kept draining a thick yellow substance with a very disagreeable odor. This was the second. Did not take either. So during this time, I was given strong medications to help bear the discomfort feeling. Because my doctor wanted so much for the next treatment to work, he suggested a skin specialist, and I thought quite a bit of him to do that, to change over to another doctor. You always have confidence in when you don't know anything else. And that was October 8th in 1972. So once again, I was put into the hospital for another third graft, and this time was done by a specialist. Again, the skin was taken from my thigh and was in the hospital for 15 days. And from my medical records, I later learned that during this time I received radiation therapy, though I don't remember it myself. After I returned home, I saw a specialist quite a few times a week. The pain and weakness were so extreme that I fainted several times. During some of my office visits, the doctor tried to cauterize on the unhealed areas of my chest and thigh, but no avail. So I continued with strong pain prescriptions. Though at my worst, my thigh and my chest looked like raw meat. I was put on a water mattress to attempt to keep me comfortable and to prevent my moving too much, thus removing the wounds.
Removing the grafts or?
Well, it was removing the wound so it'll heal. They were trying to heal it, and again it didn't. There were tiny holes in the bandage as they taped me all around real tight, and that was the second time after all this other problem. I thought, they might be taking another problem, my other breast. So there was tiny holes in the bandage on my chest so that the solution could be dampened to keep the area clean and moist. So it was painful, extremely painful, as I had to do it myself because it had to be done frequent while I was laying in the bed there. And despite these measures, it was continued draining. I needed stronger pills and pain pills and help to sleep and to calm my nerves, and I lost a lot of weight, but still I was determined to get through it. I always did, friends. It meant life to me. I wanted to live. I wanted to help people, and I'm here.
Oh my.
It's okay. I want to finish.
We're going to have some tearjerkers
It's all right.
today.
It's all right. It's hard to believe it was me because I feel so well. That's why I'm crying. I hope you all understand. I was going downhill and getting worse. This became evident when I felt a lump on my neck and started to feel pain and had several lumps on my right side of my stomach. Because of these symptoms, the doctor decided to put me back into the hospital for a gastrointestinal series in December of '73. The test went through, and of course they said there was not much they could do about it, and just told my husband this was something that they couldn't do much. So my weight, of course, dropped down to from 135 pounds to 108. I went home after 15 days with assurance that everything was going to be all right, but the doctor again said privately to my husband there wasn't much he could do. From this point on, I continued to slip, but it was only the medication that was getting me through all this. But I had to think of others besides myself as the family problems were developing. Other alarming symptoms developed. I was only able to move my bowels with the, I was able to move my bowels with the aid of suppositories, and it was even difficult to urinate. The pain in my stomach was unreal. I had to use pillows underneath me just to keep myself comfortable, and even the mattress was not soft enough, and I just kept bleeding constantly through the mattress. My husband had to even get a new mattress. It was unreal. We had to separate even in our beds because of all this going on. The only thing was to keep me strong was my faith. My faith is very great, I must say. I prayed often, and others prayed for me. As the Bible urges at Psalms 55:22, throw your burdens upon your God himself, and he himself will sustain you. It was really impossible for me to care for myself and the household any longer. By now, I could not get up or walk on my own. My weight had dropped to 80 pounds or less. I slept most of the time, probably due to my medication and pain, and no longer recognized friends or relatives when they came to see me. There was times that they could come and they said they wouldn't see me the next day. My family began to think about funeral arrangements. From October of 1975, I was unaware of anything, and my husband took over then. Though a friend, through a friend of mine, ours, referred us to F.A.C.T. My husband decided to call Mrs. Ruth Sackman, as she's a most wonderful person. There's no answer to that. To this day, I still depend on her. She suggested taking me, she wanted to take me to, or suggested to send me to Mexico for my treatment. Well, my husband said that my condition was so bad he couldn't move me. It was impossible. And of course, financially, we were having it very hard too. But I'm sure if I had friends at that time would have tried to help me, but Mrs. Sackman was wonderful. She understood. She confirmed that, well, my husband said that he was afraid of losing me and that he would do anything to help me. Let's start right away. Just hope it's not too late. So Mrs. Sackman said, then we will do our best if you will be willing.